Hello, Laker community. This is episode 6 of Lakers Together, and I'm here with Tina Barnikow. Tell our Laker audience a little bit about yourself personally, and then also what you're doing for us as we manage our way through this public health crisis.
So I am a registered nurse by training. I've worked a long time in managed care prior to higher education. Prior to coming to Grand Valley, I had the opportunity to work at the MSU College of Human Medicine and their expansion here to Grand Rapids. And then I've been with Grand Valley now a little bit over 3 years in the position of the Senior Director for Health and the Office of the Vice Provost for Health.
Great. I would have thought you've been here for a very long time. We've worked so closely and intensely together over the last 6 weeks. So I thank you for your leadership, first of all.
Well, thank you. Certainly over the past several months with COVID, I've had the opportunity to work with just a significant number of people, all working so hard. I lead the technical advisory group for health, and then I also serve on the incident management team as needed to try to provide guidance as we walk through these very unusual times.
Most recently in that journey, you led us through a conversation on the new face covering requirement, and that included focus groups and work to really understand where people were at, what they wanted, and the public health guidance. Talk a little bit about where we landed and your thoughts.
So we landed at the point where face coverings will be required, both indoors and outdoors, whenever social distancing is not possible. And that certainly includes all of our classroom and academic spaces. And I think it's important to kind of step back a little bit and talk about the fact that COVID spreads through respiratory droplets. So when people talk and cough and sneeze. And so therefore, the face coverings help keep those droplets from spreading to other people. And that's especially important because we can be contagious 2 days before we even get the mildest of symptoms. And so therefore, when we wear face coverings, we protect others from being infected when we don't even know that we are or might be infected. So it's an important policy for us at this point in time to try to reduce our risk.
Do you have confidence that we will have a community that will be compliant with face covering, and what plans do you have as we have to nudge people in their behavior to be sure they understand the seriousness and the opportunity it provides?
Well, it certainly is going to be a new culture for us, without a doubt. And so with culture changes certainly comes a lot of education. And so, over the next several months, as people are returning to work or students are coming back to campus, as well as ongoing throughout the semesters, we will be doing a lot of education. People will also see a lot of signage that kind of help nudge and serve as a reminder that, oh yeah, this is a place I am required to wear a face covering. And so I think that with education, with those reminders, and as you mentioned, the desire to care for each other, because it really is not only just the person who sits next to you or across from you, but it's their parent or their spouse or their child or their grandparent that you are also protecting in that process.
So could you talk a little bit about what's been done and what's yet to come?
What we're doing now is working on those same processes to say, how do we handle things when we ramp back up? Because we do have risk, and we will potentially have cases, and so we want to be sure we're able to handle all of that. So we're working on those processes. We're working on making sure that we have clear directions around how to quarantine or how to isolate. How do we get people that are identified as having symptoms in for testing? And then how do we ensure that we have a robust contact tracking process in place?
I always like to use this opportunity to remind people to watch the Laker Together website, GV Next, for what is next. What do you anticipate in terms of a rollout? Are people watching for the pieces of this to roll out on a weekly basis from now until the start of school?
I hope that people are watching things regularly, and we will be rolling things out on at least a weekly basis. The next piece that we actually have coming up that they will see fairly soon, and that is our new self-assessment. And we've been working to actually implement a web-based tool, and Dave Portfleet has been instrumental in getting this tool in place for us and having it be something that's very user-friendly. Once people log in the first time, and they have to take a couple of extra steps to set up their profiles, but once that profile is set up, you log in each day that you come to campus, before you come to campus, and you answer literally 3 questions about testing, about exposure, and about any symptoms that you may have. It takes about 10 to 15 seconds to do those 3 questions. You hit submit, and if you have no symptoms or no exposure, you'll get a green check mark, and it will say that you are clear to come to campus. If you have any symptoms, and I'll stress here that we're talking even mild symptoms that are new to you within the past 48 hours, please mark the symptom. Yes, you will get a little red heart with a line through it and directions to not come to campus, but then we will follow up with you, kind of talk you through that, determine if you need to have testing, if we need to help facilitate that, we're happy to do that. But it's the safest thing to do for our campus, if there are, even though the symptoms may be mild, to get testing and make sure we know what we're working with.